Hello, cruel world. My name is Dr. Sohom. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. You can call me the ominous Sohominous. Now, they say that laughter is the best medicine, but what if it's an incessant cackling that's coming from inside your very head? Hearing voices can be a wild ride. It could be in constant internal chat with characters ranging from your disapproving grandma to a high-pitched chipmunk narrating your grocery shopping list, or the devil narrating your kill list. So in this episode, we're going to talk about and demystify and debunk 5 myths related to hearing voices. I'm going to answer questions like, does hearing voices always equate to mental illness? Will you be sectioned to a hospital? Will you be detained under the Mental Health Act if you admit hearing voices? Have I, as a psychiatrist in my professional career, ever seen a patient with positive, with nice, encouraging voices? And I'm also going to list some famous people who've suffered from auditory hallucinations, which is hearing voices. So just very quickly to put everything into context, as a psychiatrist, I've diagnosed several hundreds of people who have heard voices. I'll tell you about those individual diagnoses later. I've medicated, I've treated many successfully. Okay, before we begin, here are some stats for you nerds out there. I know you love this stuff. So studies suggest that a significant proportion of the UK population experience auditory hallucinations, with estimates ranging from about 5% of people to 28% of people, according to www.exeter.ac.uk. So that's quite a big range, isn't it? But basically, either way, it means that millions of people in the UK might hear voices at some point in their lives. Research shows that young adults are particularly vulnerable, so a study by Champion Health indicates that a high percentage of employees from the age of 16 to 24 experience hearing voices, with figures in that age range as high as 60%. And in terms of gender, according to Champion Health, some studies show that women might be slightly overrepresented, so they might report hearing voices more than men. Okay, enough foreplay, enough stats, let's get into the myths. Cue the music. Myth number 1, hearing voices means you're mentally ill. Right, like Chris Wallace, this is a biggie. But no, hearing voices is one potential symptom of mental illness. But hearing voices can actually happen for many reasons. And here is a list of scenarios where it's normal to hear voices, i.e. not indicative of mental illness. Scenario number 1 of non-mental illness voices is sleep deprivation. So when you're exhausted, you might experience hallucinations, which are sensory experiences that occur as you're falling asleep or as you're waking up, and they can include hearing voices. So I've got a question for you, my Psych for Sore guys and gals. Psychiatrists like to sound clever, we like to give things complicated names. So what is it called when you're having a hallucination when you're falling asleep, and what's it called when you're having a hallucination when you're waking up? Answers very shortly. Number 2 reason that you can have hearing voices not with mental illness is sensory deprivation. So spending a long time in a quiet or isolated environment with a very little stimulation, like that time you spent 2 weeks in a caravan in Scunthorpe with your parents, can lead to hallucinations, including hearing voices. Number 3 reason why you might hear voices that's not to do with mental illness, probably quite an obvious one, substance misuse. Alcohol, drug use can sometimes cause hallucinations, especially taking hallucinogenics like magic mushrooms, like that time you ended up talking to a bush for an hour and a half in Amsterdam about the geopolitical complexities of the Middle East. Number 4 reason why you might hear voices not related to mental illness is grieving. So you might hear the voice of a loved one who's passed away. It's not uncommon and it's absolutely normal during the grieving process. Number 5 and final reason why you might hear voices outside of mental illness is migraine. So some people experience auditory hallucinations as a migraine aura, or even just before epilepsy if it originates from your temporal lobe, if I remember correctly from medical school, which was many years ago. But, and I like big buts and I cannot lie, hearing voices obviously can also be indicative of mental illness. So there's several mental health conditions that include hearing voices, many of which I've diagnosed, including schizophrenia, bipolar disorder, schizoaffective disorder. So I don't have time to get into all of those now, but these are characterized by not just hearing voices, but an altered perception of reality in general. And there's often other symptoms like mood swings, like social withdrawal, like difficulty concentrating, like being distracted. So basically what I'm talking about is psychosis, right? So the term psychosis is often misunderstood. It's got nothing to do with kind of losing control or violence. It is a temporary period of stepping out of reality. And the two most common symptoms are hallucinations, which is exactly what I'm talking about, hearing voices. You can have visual hallucinations as well, or delusions, which are fixed, unshakable beliefs, usually paranoid in their nature or grandiose in their nature. So these are temporary kind of periods. They can be induced by those mental illnesses, can be induced by drug-induced psychosis. In fact, I've got a video, I kid you not, I'm not making this up, about not one of the main Wu-Tang Clan, but one of their affiliated rappers who got into a drug-induced psychosis, and he cut off a bit of his body. I'm not going to tell you which one because I want you to watch the video, but I mean, it's never good to cut off any part of your body, but it's pretty much the worst part of your body that you can cut off. You know what I'm talking about. The links will be in the comments section. Always be plugging. So that begs the question, if some things are mental illness and some things aren't when you're hearing voices, how can you tell the difference? And the honest answer is it's actually very complicated. So you need the expertise of a handsome psychiatrist who never skips leg day like myself, simply because there's so many subtle differences. We've seen thousands of cases and we've studied lots of different symptoms and presentations. So I guess what I'm saying is it's really hard to tell unless you've had the medical training. However, as a broad kind of guide to red flags, if the voices you're hearing are distressing, if they're intrusive, if they're commanding you to do harmful things, if they're commentating on you, and additionally, if they're accompanied by other uncomfortable symptoms like paranoia or delusions or specific changes in mood or behavior, all of these things can suggest that they are more likely to be due to an underlying mental illness. Okay, my Psych guys and girls, I asked you before, what is it called when you have bizarre hallucinations when you're falling asleep? They are, sorry, didn't catch that. Speak up. Hypnagogic, that's right, hypnagogic hallucinations. And hallucinations when you're waking up are called hypnopompic hallucinations. Moving on, myth number 2 about hearing voices are that the voices are always evil demons. Listen, not all voices are like a grumpy, grouchy, ghastly, gory, horrible goblin living in your grey matter. Some voices can actually be helpful or encouraging, like a tiny internal cheerleader or like a miniature sort of hype man for the rapper that is your brain. And I suppose, having said all that, it's a fine line between encouragement and encouraging voices and grandiose delusions. So basically, if you're hearing voices that are telling you you're awesome and constantly reminding you to floss, cool, that's fine. If you're hearing voices telling you that other people should be bowing to your superior intellect, that's a bit much. If you're hearing voices that are telling you that you're so special that you don't have to follow the Green Cross code, you don't have to look when you're walking through traffic, and that cars will automatically stop for your eminence, we're gonna have a problem here. If I'm being totally honest, in my career, I've only seen this, so positive voices, once. And I completely accept that my patient cohort is probably skewed because I assess violent offenders in prisons and in courts. I give evidence in criminal trials. So usually they're quite unwell and they're quite paranoid. So, you know, almost by definition, they're not going to have pleasant voices. So the people that I assess have voices telling them that people are trying to kill them or are following them, excuse me, or are trying to poison them, that bad stuff is happening, and they sometimes act out preemptively with violence, which is why I'm assessing them in the first place. Also, the other thing is that if you do have happy, encouraging voices, then you might not even present to mental health services. So I wouldn't see those people as a psychiatrist. So what I'm trying to say is that I know that my view of patients is skewed. But I have seen it on one occasion. So one occasion, many, many years ago, I saw a very intelligent university student. He actually, just a couple of months before I saw him, got a first-class honours degree in philosophy at a very prestigious university. Sadly, he developed schizophrenia. He became very withdrawn. He barely left his room. He became paranoid about his family members. He stopped talking to them. So there's no like violence. He wasn't a forensic psychiatry patient, but he was not functioning particularly well. And he had this internal voice which he would have philosophical discussions with. He found that voice comforting and inspiring. But I have to say, I've only seen it once in my entire career, and I've seen well over 1,000 people with paranoid or grandiose or bizarre voices. So, you know, even if my cohort is skewed, I think it's fair to say that it is extremely rare in my clinical experience. Okay, moving on. Myth number 3. Psychiatrists will lock you up and put you in a straitjacket if you admit that you hear voices. Don't worry, men in white coats won't come to take you away. Firstly, because psychiatrists don't wear lab coats anymore due to infection controls, but that's not what I'm talking about. If you're hearing voices and it's not deemed to be a human experience, I'm not talking about grief or sleep deprivation. If you're hearing voices and it's known to be for psychosis, then you might be offered treatment by psychiatrists, maybe antipsychotic medication, but you will not be detained or sectioned under the Mental Health Act unless you ought to be so detained. Number one, in the interests of the patient's own health. Number two, in the interests of the patient's own safety. Or number three, with a view of protection of other persons. Now, those aren't random posh words that I'm trying to say to sound clever. That's the formal official phrasing with the Mental Health Act. And if you're a psychiatrist, you have to officially write in detail why you think somebody needs to be detained. So you basically have to justify and explain in detail why the patient fits at least one of those criteria. Your paperwork has to be agreed on by another independent psychiatrist, and it goes through a whole process of the Mental Health Act office. The point I'm trying to make is it's a complicated process. It can't just be done willy-nilly, and you have to really prove one of those points. So it has to meet one of those criteria to section somebody if they're hearing voices, or in fact any presentation. So let's go through some hypothetical things. So if you were hearing voices and you needed to be sectioned or detained in the interest of the patient's own health, that would be like a voice telling you not to take your medication or to go and smoke a bunch of crystal meth. So I, as a psychiatrist, think that there's a massive risk that your mental health might deteriorate. For hearing voices in the interest of the patient's own safety, that might be a voice telling you to go and jump off a cliff because you can fly, or a voice telling you to go and slap Mike Tyson in the face and tell him that his facial tattoo looks like a 7-year-old with ADHD drew it on in crayon. In terms of view to the protection of other persons, that might be a voice telling you to go and hit your neighbour on the head with your shovel. So as you can see, these are very specific kind of scenarios, and if you're compelled to act on those voices, then it can fit one of those three criteria, then you might need to be detained. Versus, for example, the other person I told you about, a very intelligent philosophy student with schizophrenia, his voices himself alone doesn't mean that he needs to be detained. He did need to be detained, but that was for his social withdrawal, that was another reason. Okay. So if you did present like this guy with voices that were comforting and it wasn't affecting your functioning, and if you did present, you probably couldn't really get any help from a psychiatrist, because we mainly medicate people. We don't need to medicate you. So you're probably it's more appropriate for you to see a psychologist or a therapist. They might help you understand your inner chatter and develop coping mechanisms. They won't judge you for having a chatty brain. They might even offer you some pretty effective coping strategies. For example, how to ignore your voice if it's becoming distracting, how to differentiate reality from hallucination. Okay, moving on. You can do it. Get you back into it. Myth number 4. You cannot have a job or a normal life if you hear voices. That is simply not true. There are plenty of people with experiences of hearing voices who have lived fulfilling lives. There's some famous artists, inventors, even politicians who've reported hearing voices. Many successful people through history have opened up about their experiences. Here are a few examples. Before I get into that, I just want to introduce you to this channel. It's a Schmike for Small Minds. I make a smorgasbord of videos about mental illness and offending and violence and the crossover between the two. Recently, I've been doing these 5 myths videos, some of them about mental health, like bipolar affective disorder, like men's mental health myths being debunked. Some of them are about social issues like toxic masculinity, kidnapping, like gaslighting, cults, like about stalkers. So there's something for everything on the channel. I implore you to subscribe. Not only does it help me out immeasurably, but if you subscribe to my YouTube channel, you will never sit next to a crying baby on an aeroplane, guaranteed, or your money back. Okay, so some famous people throughout history that have reported hearing voices. There is the Joan of Arc, the legendary French heroine who claimed to hear voices from saints and angels instructing her to lead the French army against the English. She's also famous for starring in Bill and Ted's Excellent Adventure. Oh, it's under Socrates. Bogus. Number 2 famous person in the past who has heard voices is Charles Dickens. So the renowned author of classics like Oliver Twist, Please Sir, can I have some more? Is believed to experience auditory hallucinations that might even influence the way that he imagines his vivid characters and storytelling. So obviously this is an example where voices can be a positive force. Number 3 example of somebody that's heard voices is John Forbes Nash Jr., the mathematician whose life story was depicted in the film A Beautiful Mind. So Nash struggled with schizophrenia, included hallucinations such as hearing voices. There has to be a mathematical explanation of how bad that tie is. Ooh, thick burn, as my kids would say if anybody said that to me. Number 4 person who's admitted to hearing voices is Kanye West, controversial rapper and fashion designer. He's expressed his experiences of bipolar disorder, which can sometimes involve, in his case, hearing voices, which begs the question, some of the outrageous things that Ye has said, is that related to mental illness? Is that part of his personality? Is it just his own quirky perspective? Somebody should make a video on that. Oh wait, I did that-ish. So I've done a video on my analysis of Kanye and his controversy. I'll put the comments in the description, always be plugging. Number 5 person who has heard voices is Anthony Hopkins, the acclaimed actor known for his intense performances. He's spoken openly about his inner voice, which he describes as a critical friend, offering guidance and sometimes challenges. A census tester once tried to test me. I ate his liver with some fava beans and a nice Chianti. Number 6 and final person on my list who has admitted to hearing voices is Fiona Dolores O'Riordan, the lead singer of the Cranberries rock band. Fiona has spoken openly about hearing voices as a source of inspiration for her music. With their tanks and their bombs and their bombs and their guns in your head, they are crying. Right, moving on. Myth number 5 about hearing voices is that you are superhuman, you are telepathic if you hear voices. Whilst hearing voices can be a unique experience, it doesn't automatically grant you superpowers, unless of course your superpower is freaking people out on the bus. However, if it's associated with psychosis, with mental illness like I've talked about earlier, like with mania for example, especially in bipolar affective disorder, it's not uncommon to hear voices but also have delusions of grandeur, like that you can read minds, or that you can fly, or that you're related to Jesus, or that you have special powers. These are all things that I've heard from patients. Or that people actually care about your YouTube videos enough that you take hours to make, that they're courteous and considerate enough to like and subscribe. You know who you are. But it's actually not true. So it's a fine line between feeling good and inspired about your voices and actually being sort of delusional, grandiose, psychotic. Okay, we're almost at the end. To conclude, there are millions of people worldwide who hear voices. If you're watching this video and you're one of them, you are not a weirdo. You're part of a vibrant, maybe slightly chaotic, maybe slightly unhinged club. But there are online communities and support groups where you can connect with others who will understand your experience. Remember, hearing voices can be a challenge, but it doesn't have to hold you back. With a little understanding, a little humour, maybe some therapy if you need it, many medication in extreme cases, you can learn to live a happy and fulfilling life, voices and all. Okay, I'm just going to finish to summarise some of what we learnt. Loads of famous inspirational people have heard voices. Joan of Arc, Charles Dickens heard voices. It can be a normal human experience, not necessarily mental illness, such as sleep deprivation. It can be part of grief. Could be a symptom of migraines. You won't get detained under or sectioned under the Mental Health Act unless there's a risk for the patient's own health or your safety or the protection of other people. You talked for a bush for an hour and a half in Amsterdam. Voices can occasionally be comforting. Studies suggest that a significant proportion of people in the UK experience auditory hallucinations, voices, somewhere between 5% in some studies to 28%. I never skip leg day. Okay, that's it. One last comment, which is let me know in the Schmoment section below if there's any specific mental health issue rather than violence issue that you want me to debunk, any kind of specific mental illness diagnosis or just a concept or a treatment, ECT, etc., etc. Let me know in the Schmoment section below. That is it. Have a blessed day. Buy my goddamn book and do not forget, I love you.